Yes. So Mirgam Ado.
Yes, sir.
Yes. So Mirgam Ado.
Yes, sir.
Right. Yeah, this is the card. So you are ready. So now we can start the session. Yeah. So once you are ready, you can start, Mirgam.
Okay, sir. So,
Yes, you can start now.
good afternoon.
Good afternoon, nurse.
Please have a seat.
Thank you very much, nurse.
Well, I'm Mirgam, one of the registered nurses working in this medical clinic. So, how may I help you today?
Nurse, actually, the doctor wants me to start having insulin injections,
Mm-hmm.
and that's why
Okay.
I'm here.
Mm-hmm. So, don't worry, we will discuss in detail regarding the insulin injection. So, before moving further, may I know your name and age for my documentation purpose?
My name is Abraham Lincoln, so you can call me Mr. Lincoln, and I am 60 years old.
Okay. Well, Mr. Linker, you are here for your yeah, for regarding your insulin injection. Am I right?
Yes, of course, nurse.
Okay. So, what do you feel regarding your insulin injection, right? Regarding self-administering injection, do you have any doubt?
Yeah, actually, I have been managing my condition very well, my diabetes very well
Mm-hmm.
for the last 4
Okay.
years. I have been taking
Okay.
the medications, exercise, doing the exercises, and taking proper diet as recommended by the dietitian. Everything is
Mm-hmm.
going on normally and smoothly, I felt. Then
Mm-hmm.
suddenly there was the doctor asked me to take blood test, and he's asking me to do this. Why should I change my treatment plan?
See, Mr. Linker, I truly appreciate you. You are following your medication and diet exercises. But see, recently, doctor assessed your blood glucose level. So they found that your blood glucose level is higher than normal limit. So it is necessary to take insulin injection for your current situation. So am I clear to you, Mr. Linker?
Yeah, that's fine, nurse, but I'm a bit anxious and I'm unsure about starting insulin injections because
Okay.
I have been managing well with my diabetes medication till now, so I'm little bit worried.
Mhm. See, Mr. Linker, please don't be anxious regarding this procedure. I will explain it to you detail regarding how you can manage it. So, may I proceed for that?
Yeah, one more thing I want to tell you. I just don't
Mhm.
really like the thought of injecting myself. I don't think I'll be able to do it because I'm afraid of needles and pinprick.
See, Mr. Linker, it is quite common to feel like you can't do, but see, definitely after showing, definitely I will show you the procedure. After that, you can do it by yourself. So don't.
Okay, nurse, then go ahead and explain me everything. Okay, but
Okay.
before that, is there any other way to manage my diabetes other than insulin injections?
See, Mr. Linker, if this insulin injection only help to you for your condition. So it is important to take insulin injection only.
Okay, nurse, carry on then. Please continue with telling me the procedure.
Okay. See, Mr. Linker, we are having four sites. You can inject your insulin in the shoulder area, or apart from this abdomen or thigh, you can inject it this side. And the most important thing is you need to rotate the injection site. Don't inject in a same side. So are you able to following me?
Yeah, of course, nurse. I
Yeah, or
understand. The information is clear. Can you tell me further?
yes, yes, sure. See, before injecting the insulin, it is important to wash your hand properly, so it will prevent from infection. So see, like this, you have to load the insulin injection in the syringe. See, like this. For the 1 ml, you should load, and after that, the needle should be 45 to 90 degree. You should put the injection and place it for 5 to 10 seconds. So, is it clear for you?
Yeah, of course, nurse.
And yeah, and apart from this, if you will notice any bleeding, means just press a pressure on the dead side, but don't rub the injection site. It will make cause like bluish on your skin. So, are you able to do this, Mr. Linker?
Yeah, I feel better about the injections now, and I
Yeah.
am ready for you to watch me give myself an injection, nurse.
Okay. Yes. Yes. And see, one more thing I need to add. So regarding the disposal, like the needle and the syringe. So please destroy in a different container. It is very important to separate the needle and the plastic things. So uh, yeah, these things you have to do. And after that, the remaining the insulin medicine, you can keep in a refrigerator. It will help to uh, prevent the you can use that medicine furthermore. And it is very important to do not expose the medicine in the sunlight and the high temperature. So, am I clear to you, Mr. Linker?
Yeah, that's absolutely clear, nurse. Thank you very
Okay.
much for the valuable information. Is there anything else I need to know? Do you have any brochures or any other things?
Yes, yes, definitely, Mr. Linker. Here is the brochure. In brochure, it is mentioned the all the process how to give the injection. It's mentioned here. If you have any doubt, you can come and directly ask to me. I will here to help you. So, is there anything else I need to clarify you, Mr. Linker?
Yeah, that's clear, nurse. Absolutely clear.
Okay. Thank you, Mr. Linker. I'm glad that I cleared your all doubts. And if you have any queries, you can come and contact with us. We are here to help you. So thank you. I wish you a good health.
Thank you very much, nurse.
Thank you.
Yeah. So now coming to the point, yes. Let me give you the feedback. Now don't
Okay.
speak anything. I'll give you the feedback. Then afterwards, if you have any doubts, I'll give you time to speak. So first thing is, Mirgam Ado, I have to appreciate you in the first place. You are very speaking. Yeah, you are outspoken. You're speaking very boldly. There is no panic, no confusion, no tension. You're doing well. I appreciate it. The next one, you have some things to rectify in your speaking style. You are saying uh, like that. So these are unnecessary sounds. So you have to avoid these unnecessary sounds. Instead of opening your mouth and making some sound when you don't have anything to speak, better it is to zip your mouth or close your mouth and not making any sound at all. So that 1 2 seconds you can just be silent rather than opening your mouth and saying like that. So the video is there already. I'll send you the link afterwards. You can watch that and you can know. And so you'll know how you are making that mistake and you can rectify there. Okay. Next. Second thing is pauses and breaks. Sometimes you don't know what to say. and you are waiting for 1 or 2 seconds, or even sometimes 3 to 4 seconds. So there's pauses and breaks. You have to control. So that, yeah, that's fine, no problem. But it should not be too many times, and it should not be too lengthy also. Then third one is, you're saying multiple times, see Mr. Lincoln, see Mr. Lincoln. So every time you start beginning to answer me after my question, you say, see Mr. Lincoln. I am with you. I'm attending you. I'm hearing you. Okay. So there is no demonstration also for you to say, and I'm not watching, like that. So there is no need to say see. And there is no need to say Mr. Lincoln also so many times. Because I'm the only person. There is no Mr. XYZ again there. So no need to bother calling the name repeatedly. You can just speak normally, because only two people are there, you and I. So automatically I am the listener. So you need not tell every time Mr. Lincoln, like that. The next one is, so in a casual way you are speaking. Yeah, that's fine, but you can improve the quality. I appreciate your concerns regarding insulin injections, or your concerns are appreciated. So I agree with your concerns. So I also is not necessary. So your concerns are appreciated. Okay. So I, we, you, such things also you can avoid. So quality will improve, definitely improve. The concerns, the expressed concerns are appreciated or welcome. Okay. It's quite common for any individual to ask such questions initially before taking insulin injections. It's quite normal. There is nothing extraordinary about it. All the patients express this, their doubts. So this is the way how you can expand. Now, I'm going to explain you about insulin injections. So now I will explain you about how to take insulin injections. So why this I will explain you. Why to say I will explain you? Just directly explain. Just directly explain. Okay. The detailed information will be provided. You can say like that if you want. The explanation about the procedure for self-injecting insulin will be provided, or it will be demonstrated or provided or explained. So however you want to say, you can say I, you, he, she, it, all these things you can avoid as far as possible, because those are personal pronouns, and these personal pronouns will not be there in formal sessions. So I tell you, it becomes personal. So information will be provided. No need to say I will provide you the information or I will explain you. No need I. So that will not be there in the books. You read many stories, right? In many histories, science, mathematics, or English, or anywhere you see. You don't see these words I, we, you. That's not formal. So general, classical, formal style, official style should be maintained. So emancipate yourself and stop using I, you as far as possible. So make it commonly applicable for everyone. So explanation will be provided. So like that. So you can use passive voice to best explain the things. The next one. There are 5 specific sites for injecting insulin. The 2 shoulders, the 2 thighs, the inner areas, and then the area surrounding the umbilical cord, belly button, abdominal area. You cannot take the injections repeatedly in the same place. So you cannot take, avoid you. These injections should be taken on a daily basis. But repeating the same site or location is to be avoided, is restricted because of multiple reasons. For example, repeatedly injecting at one particular site may result in bruising, swelling, irritation, itching, or rashes. So, avoiding this repeatedly taking on the same site is recommended. Instead, rotating these 5 sites is beneficial. So you can go in a clockwise direction. Clockwise direction. First the right shoulder, then the right thigh, then the belly button, and the right left. So left shoulder, okay, left shoulder, left thigh, belly button, right, yeah, thigh, and right shoulder. And again, the same thing. So it will go in a clockwise direction. That's always the better. So and make a note in your diary so that you, even if you forget, that will tell you. In advance, you can write and keep for 1 week. So Monday, Tuesday, Wednesday, Thursday, Friday. Then again, okay. So you can rotate the sites. And the needles and the syringes. You can use a single-use instruments for this purpose, because repeatedly using the same needle may result in, they become hard and difficult to pierce, and it may trouble, okay, the injection site, and it will cause some difficulty, inconvenience. Okay, so that's why taking a new needle, new syringe every day is better. So this is the way how you can explain. I did not use I did not use you. I just talked the subject. So talking the subject is more important. If you prepare like this, you will get A grade or at least a B plus. Okay. B plus is 400 above. A is 450. So that's how you can improve your quality. And coming to the point, grammar. You can join 2 sentences and club those 2 sentences to make a simple or complex or compound sentences. If is the conjunction. If you take, if you rotate the injection sites, then you can avoid the chances of bruising or swelling or itching. So if you rotate the sites, then you can avoid, you can prevent the infection and bruising and swelling. So this is the way how you can join 2 sentences using if. If is a coordinating conjunction, so it is a complex sentence. You can use and, okay, or, but, yet. So such words, okay, coordinating conjunctions. If is a subordinating conjunction, so complex sentence. You can use coordinating conjunction like but, and it becomes a compound sentence. Okay. So simple sentences also you can use some phrases. You can use some phrases and make them simple sentences. The next one, vocabulary. Quality vocabulary. Use quality vocabulary. Take, consume. Okay. If you take injections, self-injecting injections. If you take injections on your own, that means self-injecting insulin injections. Self-injecting is one word. So you are using quality here. Okay. Instead of saying you should take your own injections, self-injecting injection. So self-injecting, one word is avoiding many words. So like that one. At the same time, at the same time means simultaneously. Simultaneously. So this is the way how you can speak. So fluency is there. Okay. Accuracy. Yeah. To a lot, it's a lot better. So that's fine. Now you can start your video and you can speak your feedback. You can give your feedback. What do you think about this session? Yes. So you can start your video and you can start your audio now. Yeah.
Yes,
Yes,
sir.
you can speak now. This is your time, 1 minute to 2 minutes. You can share your experience. How did you feel? What type of feedback you got? Whether it was beneficial or not? How you felt during this live session? You are gaining more confidence, and you can really face the examiner. Yeah.
First of all, thank you, sir, for giving me such beautiful feedback. It is very effective for me. So before that, I thought that we have to use the patient name at least uh, 2 or 3 times. So that's why we are using more times. So okay. And regarding the he or she, we have to avoid. So from now onwards, I will like try to avoid such things. And regarding the uh, grammar, you said that we can join the two sentence in a one sentence. Like we can use if, and after that we can then you use we can make a one sentence at one time. And regarding the vocabulary, we have to use like such advanced vocabulary. So yeah, that thing.
Yes. Very good. Thank you for your feedback.
Thank
So
you.
now what you can do is there is nobody else, only Mirgam and Nazia. So you can do one more speaking session if you want. Okay.
Okay, sir.
So the second card, it's there already. The book I sent in the group and personally. So in the group I sent. So you can take from the book and yeah, I will send it to you also personally so that yeah, in the group OET Nursing September group, I'm sending to you
Yes.
personally. So Nazia Gafur and yes, Mirgam. Yeah. So I sent to you. So you can prepare the second card and be ready. After Nazia,
Okay,
I'll
sir.
take you again. Yeah.
Okay, sir.
Yes. So that video is stopped. Now next, Nazia Gafur. Hello, Nazia Gafur. Hello, Nazia Gafur.
Hello. Good
Yeah.
afternoon, sir.
Good afternoon. So now your speaking session. So there are two options for you. It's a video recording or audio recording. Both are okay for me. But if you do video recording, you can see your expressions, you can see your everything, and you can improve your quality of presentation. You can see your gestures, body language, facial features, and lot more things. So this is your choice. If you say you can select anyone, video or audio, you can tell me openly, no problem for me.
It's okay, sir. For both module, both
You are
it's
okay for
for me
both,
fine.
then fine, that's good.
Yes.
You are bold and you are strong. That's very nice. Now you can start your video. Yeah, right. So